Today we take a look at Towson Sports Medicine, the premier practice in physical therapy, hand therapy, and athletic training. I got the chance to check out two of their convenient locations in Towson.
I love Towson Sports Medicine. Even though we're part of the bigger University of Maryland system, we function as a much smaller entity in ourselves, and we've always been a big family at Towson Sports Medicine.
Christina Lewis is the director of Towson Sports Medicine and a physical therapist. She's also been a part of the family here for 23 years now.
So Towson Sports Medicine treats virtually every orthopedic type injury. We treat little children, we treat geriatrics, we treat people who are recovering from total joint replacements or spinal injuries. We treat competitive athletes. We treat virtually the full gamut of orthopedic injuries.
Their first step, as always, is an evaluation so that they can tailor treatment to the individual's physical needs and desired outcomes.
Some people just want to get back to pain-free walking and everyday activities, while some people want to get back to competition.
That can mean a mix of hands-off and hands-on exercises, and for many, the use of Towson Sports Medicine's pool.
So at our Bologna location, we have a pool, and many patients benefit from the properties that the water can provide. One of which is the reduction of gravity. So many patients can get in and get back to normal walking without the use of their cane or their crutches or their walker. As well, when you reduce gravity, we can get patients in the deep end and they can hang and get a traction force on the spine, which is very good at reducing spinal pain.
Another way they can reduce pain and work on energy flow is a practice called dry needling.
So functional dry needling is similar to acupuncture in that it uses small needles inserted into the skin. With acupuncture, it's a very old Eastern medicine that's been around for thousands of years, and the point of acupuncture is to open the body's energy or chi. With functional dry needling, they use similar needles, but the needles are inserted into soft tissue restrictions such as trigger point. It can be used on virtually any part of the body. It can be used on any of your itises, tendinitises, bursitis.
The 19 physical therapists here handle the evaluation of golfers, runners, and throwers, offer osteoporosis management and concussion management, but also tackle vestibular treatments as well.
It's a broad category. It basically has to do with the inner ear, which can be labyrinthitis, neuritis, benign positional vertigo, which is probably one of the more common reasons we see patients. We put them in a position where we trigger their symptoms, and then we try to move the debris out of the canal by turning their body in a way that shifts the debris in their ear through the canal and then empties out of the canal, and they are no longer dizzy.
What is the feeling that you get when you are able to successfully complete that move and someone is no longer dizzy?
It's wonderful. They are very grateful, and hopefully we only see them once or twice for that kind of a problem, because it's very easy to fix and it's usually better within a few visits. The other types of problems like neuritis and labyrinthitis are a little bit longer term. With those problems, sometimes they're triggered by viruses and they lose function in one of the vestibular system, either on the right or the left, and so we have to teach them to compensate for no longer having that functioning system. So we do a lot of balance exercises. We do things called habituation and adaptation, where we teach them how to compensate for their problem, and also we do activities that trigger their dizziness, and we do it over and over and over again until eventually that activity no longer bothers them, and then they can continue on.
Towson Sports Medicine has 5 locations, including 4 in Baltimore County and 1 in Hartford County. You can check out more by going to TowsonSportsMedicine.com. We'll be right back with more Midday Maryland right after this. Stay tuned.